The development of chronic lymphocytic leukemia, or CLL, is marked by specific events that occur along cellular pathways. Increasingly, interventions target these pathways to disrupt disease progression. The disease process begins with B-cell dysregulation. This leads to negative effects on the immune system. Two types of B-cell receptors, or BCRs, form on the B-cell surface. One is an antigen-binding subunit that allows the BCR to recognize foreign antigens. The other is a signaling subunit that initiates the signaling cascade within the B-cell. Downstream, the BCRs interact with a complex network of proteins, among them Bruton's tyrosine kinase, or BTK. This protein is overexpressed in CLL cells. The result is increased survival and proliferation of CLL cells. Importantly, apoptosis is blocked by this overexpression. Ibrutinib is among the new forms of cancer treatment that disrupt cellular pathways involved in the progression of CLL. This agent inhibits the BTK pathway. The primary effects are apoptosis and interference with the binding of CLL cells to intracellular matrices. Effects are seen inside the lymph nodes and bone marrow. These effects lead to the rise in white blood cell counts. This is a unique sign of treatment efficacy, as the CLL cells leave the lymph nodes and bone marrow. They move into the bloodstream. As response to treatment progresses, the white blood cell count decreases. The CLL cells that emerge from the lymph nodes and marrow undergo gradual apoptosis, along with the CLL cells already in circulation. This gradual apoptosis leads to a median response time of 4 months. For some patients, the best response to treatment occurs after multiple years on therapy.